The broadcast is now starting. All attendees are in listen-only mode.
Good day, everyone. My name is Krista Brown, training specialist with the APS Technical Assistance Resource Center, the APS TARC, and I want to welcome you to our Formula Grant webinar, APS Policy Development and Review, Framework for Success with Karl Urban, who is Senior Research Manager with the APS TARC. And Karl will share a little bit more about his background in just a minute. Next slide. Before we get started, I'd like to share a little bit of information. This webinar is being hosted by the APS TARC, which is a project of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services, and administered by WRMA Incorporated. Contractors' findings, conclusions, and points of view do not necessarily represent the official policy of the federal government. Next slide. As you all know, the APS TARC works with states and territories to enhance the effectiveness of APS programs by working with partners on the use of data and analytics, applying research and evaluation to practice, and encouraging the use of innovative practices and strategies. We are here to help APS programs in any way we can, so just reach out to us with the contact information that's going to be at the end, the last slide of the webinar. Next slide. All right, so housekeeping. A handout of today's slides is available for download in the handout section of your webinar control panel. You can download that at any time. Go ahead and use your computer speakers to access audio for this webinar, and the volume is entirely up to you. If you are experiencing audio problems due to internet connection or hardware issues, go ahead and log out, exit, and re-enter. Next slide. This webinar is being recorded, so if for some reason you can't make it work, you can listen to the recording thereafter. We'll let all registrants and everyone know when it's available on the TARC website. We are planning to have some time at the end for questions, and we will also have a facilitated discussion. But feel free to relay any questions or comments to our speaker as we're going, and we'll try to answer as many as we can. And then last but not least, all attendees will receive an automatically generated email in about 24 hours with a link to get your certificate of attendance. And please go ahead and take that webinar survey at the end. We really like to hear from you, and we get great ideas from you as well. So, okay. Next slide. All right, I'm going to hand it over to Karl, and I'll probably be launching the first poll. So there you go.
So good afternoon, everybody. So we're going to talk about policy today. And so we want to get some sense of who you guys are. So here's our first poll question. The responses are: I'm the boss, I'm the program specialist that writes it, I'm the trainer that teaches it, I'm field staff that uses it, or I'm something else. If you're something else, you might put that in the questions box for us, just so we can see who you are. Krista, go ahead.
All right, I launched, and we are getting responses.
Oh, I'm not seeing them. I forget that that's in web. Yeah, okay.
That is okay. We'll let it go a couple more seconds. We're almost at that 75% mark, which I like. Go ahead and cast your vote. All right, I'm going to go ahead and close it and show our results. There you go.
So what do they show, Elizabeth? Because I can't see them, remember?
Oh, you can't. Okay, so what they show is about 24% of our participants are the manager that approves it, 41 are the specialist that writes it, and about 35 are the other, and we have QA manager and also both training and policy for other.
So the biggest one is I'm the program specialist that writes it. So
yes,
good to know. So we got another question. This one's a bit of a leading question, and it says, I believe that policy is essential to program success. It's necessary, but not a sufficient cause of program success. It's not that important to program success, or you really don't like policy. It's something that does more harm than good to program success. So how do y'all feel about policy?
All right, we have our votes coming in. Wow. Okay, I think this is unprecedented how fast and how sure our participants are. Okay, I'm going to go ahead and close it and share. So Karl, 95% of our participants essential to program success, and 5% is necessary but sufficient cause of program success.
So that's probably one person. So that just puts a lot of stress on me since since y'all consider this so important. I better do a good job with this, huh? So let's talk about what we are going to do today. So we're going to talk about the nature of policy. We're going to try to give you a strategic framework to think about how it works in state government, how you develop policy, and then within that framework, how you implement it, how you actually use it and review it and revise it, all of which is geared to that APS TARC mission of improving program effectiveness. So you can see some of the things over on the right side of your screen there that we're going to specifically talk about. So probably the first question you want to know though is why Karl? Why did they get Karl to do this particular webinar? So I'm kind of the policy geek, if we have such a thing, on the APS TARC. I do have a master's degree in public policy from the LBJ School at the Lyndon B. Johnson School of Public Affairs at the University of Texas at Austin. Woohoo, hook 'em horns, right? Probably more importantly, I worked for Texas state government for 25 years in a wide range of policy positions throughout the years, from conducting lowly research as an intern to being the assistant commissioner for adult protective services. And like I said, that was sort of at all levels of the policymaking progress, from helping to write parts of Chapter 48 of the Human Resources Code and working with the Texas legislature for years. Not a lifestyle I recommend to anybody. To being the assistant commissioner that proves things, to working with our staff on writing the handbooks that drove the policy in the program. As we get started, I think I should acknowledge a couple of things. First is I would like to thank the APS TARC team who contributed a number of good ideas to this presentation. I would also like to thank Peter Hedgemassey from the state of Texas, who gave me kind of a real world review of an earlier version of this and helped me make some good changes. I also want to acknowledge that some of you probably could be doing this webinar just as well as I could. You have lots of great experience in this field, in this area. And so I think a key part of this whole webinar is when we get to the end and we have an opportunity to discuss some of the things, and you can agree, disagree, provide examples, tell us things that we did not think of. I'll prompt you a couple of times along the way, but as we go along the way with this, put stuff in the question box as we go, if you agree, disagree, and then we'll have a good discussion of all of it at the end. So we call this, not so humbly, the APS TARC model for successful APS programs. When we started working on the evaluation a few years back, we tried to think of a framework for thinking about how do we look at programs, and we used this kind of 5P framework, which is based on policy, practice, personnel, partnerships, and performance. And the key thing here is kind of the foundation, the starting point in this chain of getting to good performance is policy. So policy guides practice, and practice is implemented through your personnel and through your partnerships, and ultimately, hopefully, results in good casework performance. Policy is necessary, but not sufficient for a successful APS program, in my opinion. So why do we think good policy matters? Ultimately, as I've said, what we want to get to, the results we want to achieve, is consistency in practices. Consistency means quality. practice. And so it's all about that high-level outcome for our clients that this consistency in practice will get us to. But it's, and I don't know if you ever really thought about this, but it's more than just that. From a process perspective, it's a way of providing protection both for the program and the agency and for the worker. Having followed policy is a way of saying that the actions that we took in any particular case were defensible. And I think if you've been around this type of social work for long, you have seen situations in which policy was not followed and in which the worker would have been much better off. The program would have been much better off if they could simply say, at least we followed policy. So that protection for the agency and worker is not to be dismissed. It's really an important part of policy. So how do we get to these results? So policy does a few things for us. It helps you to define what your expectations are by codifying your ethics and your culture. So does your policy talk about providing services in the least restrictive environment? Is that the culture of your APS program? Policy should be a key part of the training of workers. It should inform the training content that goes in for workers. It tells them how to do their casework practice. Obviously, it's what you use to guide your casework decisions. It helps you to make decisions for some really tricky things that come up in casework. And then it provides the criteria for overall evaluation of staff and overall program performance. And so we'll talk about each of these things in a little bit more detail. You know, it's kind of interesting. We've been working on this evaluation report. In the last few days, I have been looking at the in that survey, in the practice survey that was a part of the evaluation. We had a question that said, "What are your recent innovations? What are your recent obstacles?" Improvements in policy or the need for improvement in policy showed up often in those responses because programs consider it a key aspect of what they need to do to ensure casework as well as provide protection for themselves. So, what do we mean when we talk about policy? And really, policy, depending on the context it's used, means different things in different ways. And so we'll talk about that as we go through the next couple of slides. But just to get us started, I put the Wikipedia definition in here. Yeah, I know, it's Wikipedia, right? We actually had a discussion once in state office about whether Wikipedia was a reliable source to put in the documentation of a case file having to do with some medical issue or something or not. So I get Wikipedia is not necessarily the most reliable source, but it does provide a kind of a jumping off point for us. And, you know, the more I've looked at this definition, the less I like it. You can see I struck out the word proposal already and put directive in there. If I was doing the Hemingway approach to this definition, I would say that policy is something like institutionally authorized actions to solve problems. So that's what we're trying to do. It's institutionally authorized, meaning the program, the agency authorizes it. It tells you the actions you need to take, all geared towards that good casework solving problems. One way to think about policy is this idea of formal policy versus informal policy. So formal policy is kind of what's written down and communicated through official channels to everyone all the time. Informal policy, however, is the oral tradition, and it's communicated through the informal or the unofficial channels on an as-needed basis. So you get supervisor to worker or worker to worker or whatever other mechanism works there. We're going to focus on formal policy. The reality is that formal policy can't cover every situation, and so informal policy becomes important. It should be consistent with formal policy. It's the conversation you have with the supervisor about certain types of situations or certain types of clients. It's the wisdom of experience that's kind of not written down. And so you get a case in on Mrs. Jones, and the supervisor is very familiar with Mrs. Jones, and she can tell you how to work the case with Mrs. Jones. She's giving you informal policy advice to go forward. Again, that for informal policy advice should be consistent with the formal policy. Here's another way of thinking about policy. There are really different levels of policy. And so this particular slide shows 4 levels of policy, and I would argue, depending on how you want to look at, there's really maybe 5 levels. And so as you think about these, notice that they are in descending order of specificity and flexibility. The other thing to note about them is that they all need to be consistent with each other. The first 2, federal, state, and local law or ordinances or whatever you call them at the local level, and the administrative code, those 2 are law. They have the effect of law. And so you work with your external stakeholders, your city council, your county administrators, your legislature to create the law, and you work with your stakeholders to review and comment on your administrative code. So they're very much driven by your external stakeholders. They should also be informed by your internal stakeholders, but they're decided by your external stakeholders. Your administrative code should flow directly out of whatever the law is that governs your program. These things that are law are things that you have to do to be in compliance with. You really don't have much choice about. Given that, you do not want them to be overly prescriptive. Now, policy and procedure are not technically law. So in some sense, they are not mandatory like law and administrative code. But I don't suggest for the field worker that you try telling your supervisor, your state office that. They do define how you want to get casework done, and we do expect them to be followed. You know, one of the things that we've learned from the evaluation work that we've done is that when you get down to this program policy and this program procedure level, there is a lot of variation in the way different programs approach this. Sometimes it's written at the state level, sometimes it's written at the local level, sometimes it's written at both. Sometimes this type of policy contains procedures, sometimes it does not contain procedures. And so the level of detail that you get down to, particularly when you get in your procedures, is proportional to the level of risk that you are willing to accept in your program. So for example, if you don't care how someone approaches a client's store, then you don't need procedures on this. However, if you want to ensure that the caseworker knocks and rings the doorbell and does certain things and waits maybe 3 minutes before leaving, then that should be spelled out in the procedures. So I said there were 4 definite, maybe 5. The 5th level, which is not shown, is examples. I have seen policy handbooks in which you find examples of how to implement a procedure. And I can remember some interesting discussions around whether examples in policy are a good idea or not. You know, the downside that I've seen is that sometimes folks take the examples a little too literally, and the example becomes the policy instead of the policy being the policy. So when you're thinking about that term policy, in the broadest sense, it applies to all of this. In the specific sense, and probably in the sense that we're going to mostly talk about it from here on out, it applies to program policy and to program procedure. So let's talk a little bit about sources to use in developing good policy. First thing, obviously, based on the last slide, is you got your enabling authority. Whatever the law is and it says that you must do, then that should guide your policy. But, you know, authority in a public sector program in a agency flows through the chain of command. And so whatever executive direction is in a particular area will guide things as well. And so executive direction can be in response to any number of things. I'm thinking about the question that came up in our listserv the other day about unannounced visits, and we got into a discussion about a case that was decided, a lawsuit that was decided before the Fifth Circuit Court in Texas called the Gates case. And we ended up having our commissioner tell us, okay, in response to the Gates case, this is how we're going to change our policy regarding visits. And so you have your enabling authority, which is either your law or the executive direction that comes from your agency. So that's the first key source. Data. And you might not have thought about this before, but data is a really good source for developing good policy. Data is going to tell you where your practice is weak and not in compliance with the law. Do you have performance metrics in place to help you identify where you are not in compliance with the law? Have you thought about that? And we'll talk about QA in a little bit more detail here in a couple of minutes. Research and evaluation on best and promising practices within APS and related fields. This is an area where APS is a little bit behind some other social services fields, but we are advancing rapidly. So I point to the NAPSA Research to Practice Committee if you want a forum to access some information on research and evaluation. And so there is literature out there on best and promising practice that can help you figure out what I should consider in terms of the policy in my particular program. Another source is looking at other programs. What are other programs doing around the country? How do other programs handle unannounced visits? So that's the question that we got on the listserv the other day. It's one where you get responses back from other programs. And, our considered wisdom altogether across the country can help inform the policy choices that we make. Critical to policy development is stakeholders. Stakeholders are going to have a very formalized role in developing administrative code kinds of things. Probably not as much of a formal role in developing policy handbook. That's where your internal stakeholders are going to become more important. I don't know what your policy development process is, but you should probably have a process in which you get input in making decisions about what your policy is, and probably a process in which you are getting some sort of review and comment on your policy before you finalize it, getting a real world set of eyes on it instead of just, say, a state office or a county office set of eyes on it. You have to use the other people in the agency that support your program to make it work. So agency partners. So for example, HR and IT, they need to be a part of your developing policy process. You can't put in place something in policy that your case management system is not going to be able to support. That's just kind of the reality of it. And then finally, and obviously, you need the input of your legal staff to make sure that what you're doing in policy is in fact consistent with law. Lawyers tend to think they know these kinds of things. So what are some sources to not use in making policy? So first thing I list here are other programs with different cultures or expected outcomes. Crime victims, CPS, Older Americans Act. Those are very different programs than APS. They have different cultures. They kind of have different processes. They have different expected outcomes. And so you don't use them to help make your policy. Those other agency partners I just mentioned, you should not use them to make your policy. You don't want to let IT tell you how to do things. And then the last one here is the one bad case, and this is a biggie. you know, we tend to be, as humans, people that overreact to things. And one bad case is one case. You don't want to make policy off of the one case. This is where data becomes important. You want to look at the trends and the patterns and not base your policy on your exceptional circumstances. So you're like, how can other agency partners be a source to inform making policy and be a source not to use making policy? And so the point is that your other agency partners, and ideally everybody on this page, they should all be part of the process of informing your policy. Even the one bad case should be part of the process of informing your policy. But what I'm saying is that these are not the things that should be determining your policy. These are just sources that should not be determining your policy, but perhaps informing it. I suspect you guys may have some ideas on some other sources that you should not use in making policy. So if you have any of those additional ideas, why don't you put them in the questions box and we will circle back to them before we get through. So if those are the sources, okay, how do I get information to help me make good policy? And I list here a few things that are available for you. You know, in APS, we do not have federal regulations. So we have, if you go down that policy chain I showed earlier, you know, we have the Elder Justice Act. That's it. We got no administrative code at the federal level. What we do have are the National Voluntary Consensus Guidelines for APS systems. And so if you're thinking about those sources for good policy, the National Voluntary Consensus Guidelines are based on best practices. They literally did the research to say, what does the literature say is best practice? When they were writing those guidelines, they convened a bunch of APS stakeholders to say, all right, we're going to filter what the literature says, and we're going to consider what your informed wisdom is from your years of experience, and that's how those guidelines were developed. So as you're developing policy, that is the first place I would look for in terms of a resource to help inform your policy. So another source to look at are adult maltreatment reports. One of the great things about NAMERS is that it collects information that helps you to understand what is going on in the other programming. And so when we're thinking about benchmarking, NAMERS is a good source for getting some sense of what is going on with other programs. However, it does not compare to the upcoming evaluation report that we are going to publish, if I don't die, later this year on the APS system. We've been working on this evaluation report. You guys have participated in helping us with the policy profiles part of it, helping us with the practice survey part of it, and we're going to publish all of it. Again, if I don't die, sometime later this year, and it's going to give you a wealth of information that you've never had before to do things like benchmarking yourselves with other APS programs. The APS TARC here is also here to help you. So the things that we have available to us kind of reflect the things over on the left side there under ACL. We've got NAMERS data, we've got the policy profiles from the evaluation, we've got all of the TA products that we have created, we've got the listserv, which I've already referenced, and we answer ad hoc questions through our liaison work with the states regarding policy things all the time. Sometimes it's reflected to the whole world out there, and sometimes it's not reflected to the whole world out there. And so we answered a question the other day with a state regarding questions regarding discharge planning. They were having issues with discharge planners in hospitals. We were able to help give them some information related to that. So hopefully they can figure out some policy to help guide their staff to do a better job in working with discharge planners in hospitals. Last thing I'll say here is that if you've looked at the publication in the Federal Register of the upcoming proposed changes to namers, we plan to collect on an annual basis through the agency component of namers responses to a much broader set of what we consider to be core policy questions. So instead of this ad hoc set of policy profiles that we developed, we can move to something more of a policy database in that. I encourage you to look at those questions in that agency component, because I will tell you it is a struggle to figure out how to ask policy questions in which all 50 states understand and can respond to from sort of the same perspective. So if you have a perspective that says this policy question makes no sense to my state, we would love to have that feedback from you as part of that updating of the namers system. How am I doing with time? All right, making policy useful. So this gets to that policy handbook kind of level that we were talking about before. How do we make sure that it's actually doing what it's supposed to do? So a few things to think about. First is you need to create a logical framework. It needs to be something that a caseworker can find and understand very easily to direct what they're going to do. That means it needs to be in some sort of logical framework. It needs to be written down. You need to, for certain key things, go from that informal to that formal policy. So you want to write it down in clear, simple language. That clear, simple language sounds great, hard to do, which is why you need to have some sort of, as you're developing your policy process for getting the stakeholder input, just like I asked for on those agency component questions. That simple language is hard to get to, but it's important to get to so folks understand what they are doing, because they're not going to remember it all from training. So when they get back to it in policy, they need to look at it, understand it. It needs to be available. If it's not available, it's not really doing much good. As it says here, at the touch of a button. With today's technology resources, you know, I can remember going to regional offices or going out in the field with staff and seeing them this 10, 15 years ago with these big notebooks that were 3 inches thick with the policy manual in them. There's no need for that anymore. You should be able to have policy readily available at the touch of a button for your staff. And then it says here, and I bolded it, and the public. You know, and some of you might disagree with this one, but the transparency is important. It's a best practice, and it helps to build trust, and it provides an element of accountability for your staff if they know that that policy is readily available to clients and the collaterals that we have to work with. Training. You train your new staff on it, you retrain your seasoned staff on it. You know, casework practice is not all about policy, but casework practice is certainly dependent upon policy, and so it's got to be a key aspect of your training. You want to be able to support it with practice tools, and so your case management system needs to be aligned with your policy. However your practice works based on your policy, your case management system needs to be designed along similar sorts of ways. Your case management system needs to collect information that is necessary to make sure you are in compliance with the most important elements of your policy. And then you want to do other things to support it beyond just the system. What type of assessment tool do you do? Do you use to assess clients? Is it consistent with the legal framework for what you're supposed to be doing in assessing clients, what your policy says you're supposed to be doing to assess clients? Those two things should be aligned. And then finally, you get things like job aids and cheat sheets that supervisors or staff may develop, and those things are great, They may fall into that informal policy kind of thing, but they're great as long as they're consistent with the written policy. And then programs need to provide TA resources to support the policy, whether it's staff at the state office or at the county office. You know, somebody's got to be there to answer questions, because as hard as we try with the clear, simple language, we don't always succeed. So somebody needs to be there to interpret and to support it. The most important person when it comes to policy, though, is the supervisor, because it is the supervisor that has to A, communicate it when there are questions, and B, reinforce it when it is not followed, when they are reviewing a particular case. They're sort of the linchpin in making this policy thing work as a tool to get to quality casework. And then finally, if you want to make policy useful, you need to evaluate your compliance with it through your QA process. And so we will talk about that. I am curious though, do y'all have any other ideas for how you make policy useful? If you do, please put those in the chat and we may return to this question. So, using policy for quality assurance. You know, in a quality assurance program, you got to decide what are your criteria for what is important. And policy should be the first thing you look at to determine what are your criteria for what's important in defining quality casework. And so once you have established those criteria, then you can do a couple of things with them. The first thing is the supervisor can use those criteria for review and approval of cases. Looking at that evaluation data, almost all programs require supervisors to review cases before they are approved. They need to be reviewing those cases based on compliance with policy. And then the second thing is, for whatever sort of larger QA process you may have, whatever sorts of assessment tools, case reading tools that you develop, the key criteria in those tools should flow out of your policy. The reality is that policy compliance can be scored and evaluated, and there are certain policies that are important enough that you want to consider doing that. So, if you're going to go to the trouble of scoring it, if supervisor is going to go to the trouble of keeping up with it, it doesn't do any good if there's not some sort of feedback loop so that you can target areas for improvement. And you want to think about this systemically. You want to think about your worker and your supervisor compliance. If in this feedback you see there are certain types of policies that are not being followed, then you want to go back and you want to look at your training content and methods and ask, are we teaching this in the ideal way? Is there a better way that we can teach it? And then in terms of that feedback, you want to look at the policy itself. If there is not a high level of compliance with a particular policy, maybe the trouble is not the supervisor, maybe the trouble is not the content and the training, maybe the problem is the policy itself, and you should look at it and see if there is a way to revise it to either make it clearer, or if it just doesn't make any sense in the real world, get rid of it. So that's how you use it for quality assurance. Again, if you got ideas about how to use policy and quality assurance beyond that, feel free to put them in the questions box. So here's a summary list of how I know if my policy is good policy. And these are all things that we've talked about. So, is it consistent with the law? It has to be consistent with the law. Is it stakeholder informed? If it's not stakeholder informed, it's going to have problems with it. Is it easily available? If it's not easily available, it's not going to be used. Is it clear? If it's not clear, it's going to be misinterpreted. Does it have holes in it? If it has holes in it, then there's going to be situations where the caseworker does not know what to do. When you get down to those lower levels of policy, is it striking the right balance for prescriptiveness and flexibility? You know, you're not going to write policy for every situation that you come across. And so you've got to find that right balance between prescriptiveness and flexibility. Is it actually used? If it's not actually used, then maybe it's not real good. So that's another question you want to ask yourself. And then finally, do you use it to evaluate your staff and program compliance with it through your QA process? Your answers to these questions will help tell you if your policy is good policy. So this is the point where we would like to have some conversation. And I will let Krista kind of tell us how this is going to work.
Yeah, so fun times here. We're a small enough group where we can go ahead and unmute ourselves. So if you would like to raise your hand and unmute yourself so that you can speak freely to answer these questions, please do that. And Andy and I will help you along with that. And or you can use the questions box to answer. So if you have called in using your phone, you will have had to use the audio pin, and if you did not do that, we can help you and prompt that as well so that you can actually speak. So, all right, looks like we have our first question, right, Karl?
Yep, which is, what do you think is the most important benefit of good policy? We ran through a number of things earlier: culture and direction and training. What do you think is the most important benefit of good policy? And this is where we'd like y'all to talk a little bit. Get the wisdom of your years of experience and not just mine, not just the APS TARC teams. Anybody? Any additional thoughts?
So feel free to raise your hand and or use your questions box. Don't be shy.
You all said it was essential. So why is it essential? Someday we will figure out the conundrum of getting people to talk on a webinar, but we have not solved that problem yet, have we, Krista?
Not quite yet.
Not quite yet.
Okay. We've got some. Okay, maybe not. The ability. That could be the inability to speak where you are. So we have policy in our questions box. Policy can help ensure that there is consistency of practice across the state. Thank you, Deborah. It provides a framework to support practice. Thanks, Dorian.
Yep, that consistency part is really important. As is a framework. I mean, people need to understand what they're doing. Reduces bias in decision making. That's a great point that I did not make, because we all have our internal biases, and if we're following policy, hopefully we can avoid them. Great point, Brenda.
And then we have a comment from Ariel. One of the areas that's difficult to write policy for is documentation. It's hard to be clear about expectations.
Yeah, that is true. Yeah, and it's even harder to enforce. So that makes it even more complicated. So Ellen's point about understanding the why, where, and the how is important as well. Policy, it's easy to get lost in the forest and not see the big picture. And policy is a way of reinforcing that big picture of the why things are. So that's a great point.
And as far as we know, Dorian, that no one does have a notes magic wand, unless Karl's run across one.
A notes? I don't even know what that is.
I think it's a documentation's magic wand.
Notes magic. Okay, so that's a way of doing documentation. Yeah. Checks and balances. Yes, Joan. It does provide checks and balances. So next question, and I will challenge you to put this in the question box, is what's an example or a story of how good policy was important to good casework or program improvement? Is there a time that policy saved your you know what because you were able to follow it? You were able to use it as a defense for what you're doing. Does anybody have a good story they would like to tell us about use of policy?
Go ahead and raise that hand. And Julie, the comments are being shared in the questions, which means only the organizers can see. So we'll do our best to read them out loud.
Anybody have a good story? Stories, narrative is very important, very instructive. Started to try to think of a couple of good stories, and I incorporated a couple of things, but you guys have the better stories. We'd rather hear them from you than us. Any good stories anybody want to tell regarding policy? Oh, they're so shy.
And this is Andy with the APS TARC. Just as a reminder, you can raise your hand and I can unmute you at any time. So just look for the little icon that has a hand, and if you click that, we'll work to get you unmuted so you can talk live.
I should have had Andy have a story at the ready, but I didn't think about that till just now.
I don't have one at the ready, or I'd help you out.
So as we're waiting while people are mulling that over, so Ariel's comment, another topic, not a story, but trying to determine best how to format, layout policy versus procedure versus information in a way that is user-friendly, efficient, and clear. You want to tackle that, Karl?
Well, I would tackle it by following up. I would tackle it by saying, follow up with your TA liaison, and we can provide you with some good examples of that. You know, there's no magic bullet for this. It needs to be consistent with what your agency does. But I suspect that there are some good examples that we can pull from out there. We, as part of that policy review process, looked at the extant materials that was available. So we've got links to all the we did as a couple of years ago. We had links to all the handbooks, so we can look and try to find some good examples for you. Oh, I'm disappointed we don't have any stories. No good stories, anybody?
Oh, we don't want to disappoint you because you have to live to finish the eval report. So
yeah, no.
Okay,
so
well, let's see.
We'll move on.
Well, Ellen, as a supervisor, it was helpful to have policy when it came time to deal with a worker who was not doing a good job with their client plan. So so the discipline came from policy, not from me. Thank you, Ellen.
There you go.
That's a good example.
So we should have, and back on the earlier slide about the results in, it results in protection for supervisors in some sense. I don't know that protection is the right word, but your point's very well taken about that. It gives you authority. And so it's not dependent upon you personally, it's the authority of the program and not just you as an individual for that, and that's a good thing. Next question, is there a particular practice area you think it's difficult to write policy for? So we've already had one identified, which is documentation. Any others?
Dorian says cultural competency. Thanks, Dorian.
Yes. Other ideas?
Oh, good point. Rebecca says, because APS has so much gray area, it is hard to write policy that will speak to every situation one will encounter. most definitely.
Yeah.
Ellen says safety.
You know, APS has what Rebecca's comment makes me think about is that, you know, you're always dealing with that tension in APS of providing protection while respecting individual rights, and every situation is a little bit different. And so getting the policy dynamic or direction on that is a real challenge for APS.
Yes, and with an
But at the same
overlay.
time, yeah, at the
Oh,
same
go ahead.
time, it argues for the importance of policy to help you kind of cross all your I's and dot all your T's as you're trying to work through that tension.
Right. I was just going to add, with an overlay of discerning the decision-making ability, you know,
Yeah.
as well. So yeah, it gets complex.
And Karl, this is Andy. I don't know if you agree with this or not, but I think when it comes to something like safety, you know, that's where you got to have really good training because of all those gray areas with safety to bolster the policy.
Yeah. Safety is one of those areas you want to address in policy, but policy is not going to be sufficient for all of the resources that you need to get there. So I absolutely would agree with that.
I think COVID has shown us that, because there needed to be procedure around how you even put on a mask appropriately, and you know, donning and doffing, all of those things that we weren't used to.
Yeah, and COVID, I hadn't thought about this as an example, but COVID really created a need for some creative policy implementation, because you ended up with APS programs with statutes that you said you have to make contact with the client, generally interpreted to mean face-to-face contact with the client. So how are you consistent with your statute, yet at the same time providing safety and protection to your staff? And different programs work through that in different ways from a policy perspective, we know.
They sure did.
Last couple of questions. Do you have any other sources or resources that you use for good policy? What are the barriers you face in implementing good policy? Any thoughts on those?
Oh my gosh, Dorian, you are so, oh my gosh, wow, we got some hands. Sweet.
I will try to unmute some folks right now.
Awesome.
You never know what question will do it.
Dorian, you should be unmuted now.
Thank you. We face a lot of barriers also because our resources, like our staffing, is challenged. So sometimes implementing policy is hard because we're lacking the resources to implement it appropriately, particularly staff.
Yeah, that's a real, you want to write your policy to be ideal for what your casework is, to provide protection to the client, but you got to be realistic about your resources to do it as well. So, you know, and so that gets into where you need to consider whether perhaps as you go down the policy change in terms of prescriptiveness and flexibility, you provide that flexibility to try different ways to address things based on the availability of resources. As harsh as that sounds, but that's sometimes the reality of it though, right?
Yeah, unfortunately, you know, I think the response time, you know, that becomes a challenge.
Yeah.
All right, it looks like we also have, we have several Nicoles, but Nicole Palmisano, I believe, had her hand raised. So Nicole, I've unmuted your line. If you want to unmute and ask your question live.
Can you hear me?
Yeah, we can hear you.
Great. Hi, I'm Nicole Palmisano. I'm pretty new to APS, but I have a lot of policy experience from other programs, and I wanted to speak to one of the barriers, which kind of piggybacks off of the previous comments about not having resources. But good policy also requires a lot of stakeholders, and like you spoke, it requires input from varying people. And everyone's pretty busy. And so developing that in a timely way, in a timely manner, when you can get all that input and sign off, can be pretty challenging.
Yeah, it does. Those supports that you need to have in place to get it written, to meet those clear, simple, direct kind of language it's easy for me to write on a slide deck. It's much harder for you to do in reality, I think.
And I think
So that's a great point.
Typically those types of subject matter experts or legal or contract, whatever authorities you might want to involve, have a lot of competing priorities that make reviewing a policy and providing input like possibly lower on the list than we would like. But I mean, not that it's inappropriate to just have competing priorities.
Yeah. And Deborah says, there is a reluctance to do things differently than the way it has always been done. I am shocked by that idea. I've never run across that in a public program. And it is indeed a real struggle. You know, I mentioned on one of the earlier slides that you use policy for training and for retraining, and you use it for QA. If perhaps someone is resistant to doing things the new way, then that's why you have a QA process to catch it and to reinforce it. It needs to be done a particular way.
I was going to say, Karl, as you say that first, your prior comment with a smirk emoji. Anyway.
It looks like we have one other hand raised. That is for Chris Lamlin. I know we don't have a lot of time left, but Chris, I've unmuted.
Actually, we're scheduled today to go until a quarter past. So.
Oh, sorry, Chris.
Yeah, no problem.
So Chris, I've unmuted you if you want to unmute yourself and ask a question.
Hi, I'm Chris Lamblin. I'm from Michigan, APS, and I wanted to speak a little bit to one of the barriers that we have in implementing good policy here is shifting our workers' mindset from the world of children to the world of adults. Many of our workers were previously children's protective services workers, and they sometimes really struggle with the differences in policy going from one program to the other. And for me personally, in writing the policy, it's how can I word it in such a way that, you know, the protection of our adults' rights is paramount, and that they can see those, you know, those sometimes subtle differences between the two programs.
Oh, yeah. Yeah, not to be disagreeable, I would argue it's not very subtle difference. That's a very critical difference between the two programs, and it speaks to that tension that I was talking about earlier. So that's a great example. So thank you for that. Last question that we have here then is, how can the APS TARC better assist you in developing and implementing good policy? We ran through some things earlier. Wondering if you had specific questions or specific regarding policy or specific ideas about how we could do a better job of helping you guys in terms of our TA products or our ad hoc TA that we provide in response to your questions. Any thoughts on that or any of the questions that you see there?
Looks like Dorian, you also raised your hand, so if you want to unmute yourself.
Sure. So I just want to say that I find the materials that you guys have developed for us to be very helpful. And when we're meeting with our liaisons and we have questions, you guys have been great about, securing information from our colleagues in other programs so that we can perhaps, take advantage of some of their, better practices. So, I think that what you guys have been doing, I have reviewed the QA guidance that you guys have given, and we're working at incorporating them, especially as we're designing our new case management system. So I just say keep doing what you're doing. And when we ask for help, keep helping us.
Okay, thank you.
Good to hear.
Well, this isn't the only forum. So if you think of something after the fact, please feel free to email us at the TARC email or your TARC liaison. We are starting to plan for next fiscal year, so it's a good time to catch us. All right. Well, any additional questions that you were holding until the end? Any additional questions, comments? Otherwise, we'll work to wrap up.
Anything you wished we'd talked about or should have talked about?
That's a good point. Missing info.
Well, with that said, here are the resources that we referenced earlier. We kind of gave you some links to them on this particular slide. If you need to know how to get a hold of the NAPSA Research to Practice Committee, reach out to me and I can make that connection for you. Otherwise, you've got links here for everything.
All right. Well, thank you, Karl. You worked really hard on this webinar and it really showed. So thank you so much. It was excellent. And thank you also to Andy for tech support and Jennifer Kirchen and Leslie McGee for contributing to the content. And thank you, participants, for being here and being flexible enough to unmute and work with us on that facilitated discussion. Hope to see you for the next APS TARC webinar for the field on innovative responses to self-neglect on July 14th at 3 p.m. Eastern. And then the next formula grant webinar, which is especially for you, is on developing and expanding an APS QA program, which we just talked about QA a little bit, on July 28th from 3 to 4 p.m. And registration for both of those is open. Please contact us if you haven't seen it. And have a great rest of your day and week. Take care. Thanks, Karl.
Thank you, guys.